Do not ignore these 10 early symptoms of diabetes. We don't usually walk around all day thinking about diabetes, which is fine, but with the way most of us live a questionably unhealthy life these days, diabetes isn't something that just happens to some people. We're all at risk. The thing about diabetes is that you need to catch it early enough to avoid having to deal with the dangerous side effects it comes with. But here's the kicker, it's something that creeps up on you. In this video, we're going to be going over the 10 early symptoms of diabetes that you should never ignore. So if you notice these happening, you can get tested right away and be the one that's in control. 10. Extreme thirst. If you've always had a general level of hydration and thirst, and suddenly notice that you've been getting very thirsty, there's probably a reason behind it. The first thing you need to check is if there's been a drastic change in weather. If the weather is hotter and more humid than it usually is, that could be a contributor to you feeling thirstier than ever. If you've recently become more active, it would explain the increased thirst too. But if everything you're doing in your life is the same as it had always been, it could be an early symptom of diabetes. When your blood sugar levels are extremely high, your body begins to crave more water. And most of the time, no matter how much water you drink, it doesn't feel like it's enough. 9. Always need to pee. Since one of the earliest signs of diabetes is increased thirst, you might try to combat it by drinking a ton of water. Now, if you're downing flasks full of water all day, it's going to have to come out the other side too. The more water you drink, the more you'll need to pee. It makes sense. But when it's the super early stages of diabetes, it's not just regular pee. It's actually called polyuria. This is when there's so much glucose in your blood that your kidneys decide that they can't work overtime and pass on the work onto the next guy, which in this case would be your small intestines. Kidneys release the glucose and it turns into a whole lot of pee. So if you're drinking a certain amount of water and compared to it you're noticing that you're peeing a lot, it might be an early sign of diabetes. 8. Insanely dry skin. There are a lot of people that experience their skin type changing a little bit throughout their lives. Changes in your diet, where you live, what you're doing, and even the skincare you're using can all affect the way your skin looks and feels throughout the day. But even then, there's a basic state your skin is always in. You'll know if you're a dry-skinned person, an oily one, or one that swings between the two. Even people with dry skin know the level of dryness their skin normally is. One of the earliest signs of diabetes is that your skin can get extremely dry and patchy. This isn't just something that's going to happen to your face, but also the rest of your body too. The dryness tends to stay even if you're piling on thick layers of moisturizer too. If this sounds familiar, it might not be your moisturizer that's giving up on your skin. It's your skin trying to tell you that something else might be going on that you need to pay attention to. 7. Dark patches on the skin. While extreme dry patches are a pretty big sign you need to watch out for, it's not the only change you might notice in your skin if you're experiencing early symptoms of diabetes. One of the most common early signs is the appearance of dark patches on your skin. While some dark patches on your face and neck might be sunspots, if you're someone that regularly wears sunscreen, you probably don't get a lot of sunspots. If you don't wear sunscreen, first of all, start right now. Secondly, they could be sunspots that you can get checked at your dermatologist. But if they're not sunspots and they're not going away on their own, it might be the excess of insulin that's present in your blood, giving you a warning sign through your skin. This type of dry patches usually show on the folds of your body like your armpits and neck. You might also notice that the dark patches seem like they're on a thicker patch of skin. Both of these point towards being the early signs of diabetes. 6. Increased hunger. Getting extremely hungry after not eating for the whole day is a common thing. Sometimes you might even have days where you have eaten, but still feel like you could use a snack. That's pretty normal too. But if you're noticing that you're constantly hungry all day, every day, and your appetite wasn't like that before, it might not be your own hunger. It might be the diabetes wanting more food from you, like some sort of inner voice that's just like, feed me! What happens is, if you're in the super early stages of diabetes, your body starts to need to put in a lot more effort to do the things it's normally used to doing. Normally, your body would have no problem feeding glucose to your cells and keeping them, and you, healthy. When you're diabetic, this system breaks. The glucose can't be absorbed the same way by the cells and go hungry. These cells send signals to your brain telling it that they need more fuel, and for your brain, fuel just means food. In the end, you end up overloading on food, when in reality, all of that food will still go to waste because your cells won't be able to absorb the glucose. 5. Slowed healing. If you're a klutz, you're probably used to getting injured a lot and know exactly how long it usually takes you to heal. Even if you're not frequently injuring yourself, there is somewhat of a general timeline that follows when your body is healing. Concern rises when you get injured and wait days on days and are still not getting better. If your natural healing time is slowed significantly, it might mean that the high sugar levels in your body have narrowed your blood vessels enough that you're not able to get the same type of blood flow to the wounds to heal them as fast as they usually heal up. This is one of the most common signs of diabetes in its early stages. So, if that one bruise is staying a bruise, don't ignore it and get it checked out. 4. Blurry vision. With the amount of time everyone spends in front of screens these days, more and more people are noticing that their eyes are getting weaker because of the added stress. But the thing is, blurry vision isn't as normal of a thing as most people make it out to be. If you're just sitting around doing your own thing and suddenly your eyes go all blurry and get kind of moist, you're not experiencing normal weak eyesight. The blurry vision happens when your sugar levels spike so much that they end up affecting everything down to the tiniest of blood vessels in your eyes, causing a temporary blurriness. If this happens often, you should go and get tested immediately. 3. Weight loss. While it seems like a great surprise when you notice that you're suddenly fitting into clothes from years ago without even trying, it's not always a great thing, especially when you didn't really mean to lose the weight. Now, as nice as this might feel, it's actually a cause for concern. It should be even more concerning when the weight loss is also paired with increased hunger. If you're eating normally, or even more than usual, and are still losing weight, it might not be miraculous weight loss. It might be diabetes. This happens when there's so much glucose in your system that the body tries to get rid of it while also losing a lot of water. You'll pretty much end up peeing out all of the water in your body, and since there's less water in the body, you'll weigh less too. 2. Extreme fatigue. Even though this isn't really common knowledge for most people, fatigue in diabetes is so common that some researchers even call it diabetes fatigue syndrome. This is when you're suddenly finding yourself being super tired even if you're not doing much throughout the day. While this sometimes is your body asking you to relax and take a spa day or something to refresh, other times it seems like a more long-term issue. If you're waking up day after day feeling even more tired than the last, it's not just you being tired. It might be diabetes. Remember, if a quick nap won't fix it, and it's happening all the time, you might want to get tested. 1. Infections. We come in contact with a ton of germs every day. Even if you're someone that's extra careful with being all sanitized all the time, chances are that you're still going to catch an infection here and there. This is something that happens very often for diabetic people. This happens because there is so much glucose and sugar in your system that your kidneys simply can't filter it like they are supposed to. This causes the glucose to end up in the bloodstream and the urinary tract and cause yeast infections, urinary tract infections, and even gum and skin infections. That, combined with the fact that diabetes slows down healing, means that the infections are frequent and last a really long time. If this sounds familiar, it might not be germs from outside sources, but your own body causing the infections. Even though it's a pretty twisted way of your body to signal something's up, it is a pretty loud signal. If you're experiencing any of these symptoms on its own, or multiple at once, you shouldn't ignore them and make an appointment to get tested immediately. And on that note, we wrap up today's video. If you like this video and learned something from it, please give it a thumbs up and subscribe to our channel so you don't miss any of our future uploads. See you in the next one.